Hello and welcome. Today, we're diving into a really serious but often overlooked danger for people who are battling cancer. It's a condition that kind of acts like a silent partner to the disease itself, and it can be incredibly deadly. So, let's get right into it.
So, if you think of cancer as the main villain in the story, what's its deadliest accomplice? It's probably not what you'd first guess. It's not an infection or a common side effect. The answer is actually a blood clot, one that can form quietly and create a massive, life-threatening risk. And the scale of this problem is just staggering. Think about this. For every 7 cancer patients who pass away in the hospital, one of them dies from a pulmonary embolism. 1 in 7. That statistic alone shows just how critical this topic is for patients, for their families, and for their doctors.
All right, so here's our game plan. We're going to start by tracing the journey of one of these clots, from where it starts to where it ends up. Then, we'll get into the specifics of the cancer connection. We'll zoom in on rectal cancer as a kind of case study, clear up some common confusion between 2 different lung emergencies. And finally, we'll cover how this whole thing is diagnosed and treated. Okay, first things first. What exactly is a pulmonary embolism? Well, it all starts with a single blood clot, and believe it or not, it usually forms somewhere completely different in the body before it takes a very dangerous road trip up to the lungs. The big medical umbrella term for this whole process is venous thromboembolism, or VTE for short. Now, it's not just one thing. It's really 2 closely related conditions. It kicks off as a deep vein thrombosis, a DVT, which can then break loose, travel to the lungs, and become the much more dangerous pulmonary embolism, or PE.
So you can think of it as a 3-step crisis. Step 1, a clot forms in a deep vein, most of the time in the leg. That's your DVT. Step 2, a piece of that clot just breaks off. Once it's free-floating in the bloodstream, we call it an embolus. And step 3, that embolus travels up to the lungs, where the blood vessels get smaller and it gets stuck, creating a blockage. That blockage, that traffic jam in your lungs, that's the pulmonary embolism. So the big question is, why is this such a huge risk specifically for cancer patients? Well, the connection is very real and it's biological. Let's dig into exactly how cancer creates this perfect storm inside the body. Essentially, cancer can completely change your body's chemistry. Tumors release all these substances that kick the body's natural clotting system into overdrive. This creates what doctors call a hypercoagulable state, which is just a fancy way of saying your blood gets thicker, it gets stickier, and it's way more likely to form clots where and when it shouldn't.
And this risk is not the same for every type of cancer, not even close. Look at this chart. Compared to a healthy person, the risk of a clot is 20 times higher for someone with a GI cancer. It's 22 times higher for lung cancer. And for blood cancers like leukemia or lymphoma, it is a staggering 28 times higher. That's just a massive increase in risk.
But it's not just the disease itself. The very treatments we use to fight the cancer can, ironically, add to the problem. Chemotherapy and radiotherapy can damage the delicate lining of our blood vessels, which makes a perfect surface for clots to form. Major surgery means you're not moving around as much, and even things like the central lines used to deliver medication can become a starting point for a clot.
To really see how all these risk factors can pile on top of each other, let's just focus on one specific example: rectal cancer. For these patients, it really can be a perfect storm.
So you've got this cascade of risk. First, you have major surgery in the pelvis, a really tight space where blood vessels can get bumped around. Then you add pre-surgical chemo and radiation, which can damage those vessel linings. On top of that, many patients have other conditions like obesity or diabetes, which adds more inflammation to the mix. And if the disease is advanced, the larger tumor is just pumping out even more of those clot-promoting chemicals. It's one thing after another. Okay, now this next part is so important. One of the biggest challenges with a PE is that its main symptom, sudden shortness of breath, can look like a lot of other things. And the most common point of confusion is with something called pulmonary edema. Getting this right is absolutely critical. So here's the core difference. A PE is a blockage problem. A clot is physically jamming up a blood vessel. Pulmonary edema, on the other hand, is a fluid problem. The tiny little air sacs in the lungs are actually filling up with liquid. The pain is different too. With a PE, it's often sharp, and it gets worse when you take a deep breath. With edema, it's more like a feeling of pressure or heaviness. And here's a huge clue. With edema, breathing gets way worse when you lie down flat. That's not typically the case with a PE.
Honestly, this might be the best way to remember it. A pulmonary embolism is a traffic jam on the highway of your lungs' arteries. Blood can't get through. Pulmonary edema is like your lungs have turned into a soaked sponge. They're heavy with fluid and just can't absorb oxygen properly. Two totally different mechanical problems.
Okay, so now that we get the what and the why, let's shift gears to the most important part of all. How do we fight back? How do we spot the warning signs, confirm a diagnosis, and actually treat this incredibly dangerous condition?
These are the red flags. You have to know these. For a DVT, the clot that's still in the leg or arm, you're looking for swelling, pain or tenderness, redness or warmth in that one limb. Now, if that clot travels to the lungs and becomes a PE, the signs are sudden shortness of breath, a sharp chest pain, a racing heart, maybe even coughing up blood. Any of these symptoms mean you need to get medical help immediately. And this is what doctors are looking for on a scan. It's a special type of CT scan where they light up the blood vessels with dye. See how the arteries are bright white? Well, the arrows are pointing to those dark spots inside the artery. That's called a filling defect. That is the clot. That's the highway jam we were talking about, and you can see it right there, physically blocking the flow of blood.
And you can't overstate how high the stakes are. If a major pulmonary embolism goes untreated, the mortality rate can be as high as 30%. But, and this is the most crucial part, with fast, proper treatment, that rate plummets to as low as 2%. Diagnosis and action literally save lives.
So the main treatment is something called anticoagulation therapy, which most of us just call blood thinners. Now, a lot of people think these drugs dissolve the clot, but that's not quite right. What they really do is stop the current clot from getting any bigger, and they prevent any new ones from forming. That gives your body's own natural clot-busting systems the time and space they need to go in and break down the dangerous blockage.
And finally, we just have to talk about the psychological toll. I mean, think about it. You're already fighting cancer, and then on top of that, you survive this incredibly scary, life-threatening event. The source material calls this the emotional tax. There's this constant fear that it could happen again, and every little shortness of breath can trigger a wave of anxiety. And that really brings us to the bottom line, the most important takeaway from all of this. For patients, for families, for anyone involved in cancer care, awareness is your number one weapon. It is the first and the best line of defense. The treatments are out there, and they work, but they only work if the problem gets recognized in time. Knowing these signs isn't just data, it's a tool that can save a life. So the question is, are you equipped to recognize them?